Welcome to our podcast, proudly brought to you by VPA Australia, our trusted supplement provider since Unity Gym started. As sponsored athletes, we're excited to offer you a special 10% discount on top quality supplements that ship worldwide. Just use our discount code from the description. To avoid international shipping fees, contact VPA and tell them we sent you to get a flat shipping rate. Today's episode is also sponsored by the Flexibility Blueprint. Ever felt lost in the sea of social media fitness advice? The Flexibility Blueprint is your map to progress, designed to help you get laser focused on what matters most for your journey in flexibility and strength. And guess what? It's free. Grab it using the link in the description. If you're starting your flexibility journey, don't miss our 20-minute mobility routine. It's your first step to quick wins in flexibility. For those further along, use our Flexibility Masterclass, featuring advanced techniques like loaded stretching and end range strength for the pancake, front splits, middle splits, and more. Links for both are also in the description. And for the seasoned athletes, avoid the frustration of complex training puzzles with our UMS Tribe membership. It's a different online coaching experience with strength and flexibility combined. Don't forget, we're Amazon affiliates too. You can find all the equipment used in our videos and podcasts at the most competitive prices with our affiliate links in the description. Now let's dive into today's episode. Do you get knee pain after a lower body strength workout? If you do, then this is for you, because we've had a lot of people that talk about knee pain after squatting. And today we've got our resident physiotherapist, Phil White, from Phil White at .me, is it?
No, philwhite.me is my website.
Philwhite.me, there we go.
Find me on socials at Phil White Physio.
So this is our good friend Phil, who is a sports physiotherapist who has been a go-to for Yani and me for injuries. And something that so many people have complained about over the years is knee pain after lower body workouts. And lower body strength workouts, we're going to be talking specifically here. So we're not talking about running, we're talking about people going to the gym, they do some squats and some step ups and some split squats, and then their knees are hurting for days afterwards. What should you do? And Phil has an approach that I think is awesome. It's been great information for us, which is quite different to what most people do, which is they think they should just rest and not do that workout again for a while, and that's going to fix the problem. But Phil's got 5 things that he likes to look at that you can modify and adapt to keep working out, to make sure that you're not getting pain, but also because working out is generally the solution to pain as well. So Phil, talk us through it. What's your go-to solution for somebody that says, hey, I've got knee pain after I did my squats, what should I do?
Sure. Before I do, I'm going to start with 2 things. If you're in America, a physiotherapist is a physical therapist. I was just chatting to some Americans the other day. We're like, what is that? Is that a PT, like a personal trainer? So
right, I did not know that.
Clear that up.
A physical therapist, okay.
Yeah.
Right.
Well, that's what they call it in America. And 2, a sports physio is a specific master's degree, which I have not done. So I'm a musculoskeletal therapist, but a doctor of physio. But no one would care except for the few physios out there who might be watching and being like, because people, do a lot of years. It's one of the things that really.
Can I clarify why I call Phil a sports physio then? I call Phil a sports physio because I've been to a lot of physios in my time, and very few of them have given me the results to get back on my feet and keep going like Phil has. And I believe it's because Phil has so much skin in the game himself. Phil is somebody who's very active. He's got a lot of experience with resistance training, with weightlifting, a lot of experience with running, with triathlon, with swimming. He's been very active over his whole life. Sorry, Phil?
Yeah. Team sports. I did do
11 years of team sports, and so he really knows the body, and he knows about what you need to be able to do to be able to play sports. And he's had so many injuries.
And like studying sports science and then physio, and my doctor of physio degree was really about trying to figure myself out and end up in a place where I wasn't just crippled forever, because it really felt like for a while there that I just wasn't going to be able to do anything in my older age, because after playing 11 years of ultimate frisbee was my sport back in the day, and doing 4 world championships and nationals every year, and I would just end up so injured and so depressed, because I'd go and see physios who would give me some, tell me to stop doing the sport. They'd give me a few boring exercises that I would feel bad that I never actually did, but really they were so uninspiring that I never found myself doing them. And it would take me quite a while to then get the motivation to get back into playing sport. And usually I'd just sort of wait until I didn't feel in too much pain, and then just start playing and trying to do just, as hard as I was before I'd taken time off, and then re-injuring myself, and that cycle continued for so many years. So it really was doing the sports science degree in physio, but then pairing that with that practical experience of getting into the gym for the first time, which I'm so thankful for you guys, because it was Yani asking me to come to Unity Gym and try it out when I wasn't a gym person. I was a massage therapist at the time, and I just thought, nah, don't want to go to gyms. I've tried that a few times, but it was going to the gym and starting to do some strength training, then training with the powerlifter, Sebastian Orob, Australian strength coach, and getting really good strength training there. And then applying that knowledge with the physio background to realize just how big a deal this is. Because as I said, like, so many people just get these disconnected exercises from the physio and think that like it's going to be a combination of massage, taping, and really hyper-specific exercises that suddenly fix, in inverted commas, an injury, when really it is trying to get your body to adapt to that stimulus and giving the natural course of the injury a chance to heal, and then giving your body as much of the supporting stimulus as you can to get back to doing what you're doing. So what I mean by that is, it like when you do, say, a muscle tear, it will take at least sort of 6 weeks for a significant muscle tear to get back there, and no amount of massages or like specific exercises is going to necessarily speed that up, but certainly the exercises can help just provide a environment where the healing is going to be supported. And then the main thing you want to be doing is looking at, like, how can I stay engaged in training? How can I strengthen all the muscles around it and be not deconditioned in all the other areas of your body? So just a quick rant there, but getting back to the question, so we're going to knee pain, and was it squatting specifically that was the pain?
Lower body workouts.
Lower body workouts. We've just had one of our members has asked a question that so many people have asked in the past. I did a lower body workout and my knees were hurting for almost a week afterwards. What should I do? And this is part of the reason why, and you can even open by talking about this element of it, Phil. When we were at Unity Gym, we had a lot of our members that were starting with us, and they would end up going to see Phil for physio treatment after a month because their knees were hurting. And Phil ended up coming to us and suggesting that we stop getting new members to do a high bar barbell back squat and get them to do a low bar barbell box squat. And Phil, I mean, maybe you can even start by just talking through that for us.
Yeah, so specifically, so when you think about what the body is getting injured from, but also adapting to, you've got these thresholds. So you've got your kind of adaptation threshold. So when you produce enough load to go over that sort of set point that your body is used to, then you'll get the stimulus, if you recover appropriately, to get stronger and to adapt to that particular stimulus. But if you exceed that point and you go over that, then you can cause an injury. So the same movement can cause an injury, but depending on how much load you get. And when Rad was talking before about those 5 things I was talking about, they're the 5 loading principles in strength training, in resistance exercise. That is intensity, so how heavy the weight is or how much resistance you've got. Then there's volume, so sets, reps, rest, and then complete week. Like, what are you doing throughout that whole week with physical activity? Are you a plumber, for example, with the knees, who's down in a squat for most of the day or crawling around your knees? So that's the volume and the over the week. And then you've got range of motion. So how, for a squat, for example, how deep is the squat? You got speed. So how controlled is it? Are you lowering down over 3 seconds, take a slight pause and then coming back up? Or are you doing a dive bombing squat where you're bouncing off your calves at the bottom and coming straight back up? And then there's the complexity. So a goblet squat is a bit more simple than a front squat or a overhead barbell squat, for example. So we've got those 5 different things to play with, and they're going to be contributing to the total load. So what's, I think, really important is that it's so common that people think that the most, I guess, damaging load is always going to be intensity, so how much weight is on the bar. But for so often, like, people don't really realize that it's not necessarily just going to be the intensity that's the aggravating factor. For me, for example, I've got an old knee injury from my sporting days that if I go into a deep squat, the back of my knee will hurt. But if I go to a 90-degree squat, then I have no pain whatsoever. So even if I went in a body weight squat, I'm still going to get that knee pain. But if I go 150 kilo squat to 90 degrees knee position, then I have no pain whatsoever. So it is just really important to identify, okay, which of these variables is the most aggravating factor, which are the ones contribute, and how can I stay in that exercise without aggravating myself, but still looking for the adaptations that I want.
And I think that's so important. And I think that one of the other really breakthrough moments that I've seen or experienced with clients over the years is when they start to understand that there's not one way to do every exercise. Like we like to look at pictures or diagrams in a bodybuilding book or a textbook or a magazine, and there's a squat demonstrated or a movement demonstrated. I think the only movement that I would say there's a pretty good way of doing it, either in conventional or sumo, is the deadlift, because that's about very specific structures. But with a squat, there's so many different variables that need to come into play.
Yeah, even with a deadlift, you can change that range of motion quite effectively by doing a rack pull or raising it up. You can do a hex bar deadlift to change that range of motion again and allow a bit more forward knee movement. So there's still definitely variability there. And I think like the key thing is, you guys have seen it so many times where people come to the gym and like, I can't squat or I can't ever deadlift, like deadlift's bad, and they demonize the exercise without realizing that it's by changing the variables, it totally loads the body in a different way. So
yeah, absolutely. And that's one of the I think the squat, I'm using the squat as an example because it's the one that you can make a few small changes to the pitch of the knee, the angle of the knees, the width of the feet, the angle of the feet, the toes, the depth of the squat. All these little things can completely change how the movement feels for the individual, and it is very specific based on physical structures in the body, like the length of the femur as opposed to the length of your spine or tib and fib, like the lower portion of the leg versus the upper portion of the leg. Some people have really long upper legs and shorter lower legs, and vice versa, and that's going to change where you need your feet to be. That's going to change things like that. There's also variables in the design of people's pelvis. The pitch of the acetabulum, the angle that the upper leg actually,
for those playing at home,
the socket that the femur sort of plugs into in your pelvis, that angle can kind of vary from one person to another, and I've seen, really, like, to give you an example, my squat setup, my squat stance changed after my knee reconstruction. I then had sort of different tension on different areas of the body, and I needed to widen my stance a little bit and allow my knees to sort of travel outward a little bit more to make it comfortable, And so I guess I would urge everyone, before they start to really load up their lower body training, is to really explore these different variables and find what suits them most. Because for some people, the design of your skeletal structure will just not suit deep squatting. It's just not ever going to come easy for you, and it's something that you need to consider, and then you also really need to consider the length tension that's going on in your lower extremities. Like, if your quadriceps and hip flexors and that whole sort of system in the front of the legs is really, really tight, then doing a deep squat is going to put enormous pressure on your knees, and they're not going to be happy with you afterwards, So we like to say that you want to achieve a reasonable level of flexibility in the lower extremity before trying to do any sort of deep squatting under load. The idea of allowing the weight to push you into the depth of your split squat demonstrated there, or conventional squat, is a terrible concept. I've heard people say, oh yeah, I can squat deep ass to grass as long as I've got weight on my back. I just don't like that. I think that sounds really dodgy. I think if you can't do it comfortably without any weight at all, then you probably shouldn't be doing it with lots of weight.
Yeah, and I think it's important to talk about that, like why people want to be in those positions. And I think there is that kind of element of movement purism and sort of gym like purism that I've definitely been probably a part of. Like, I used to be very anti any machine weights because I was in barbell gyms, and I thought, oh, this is, you get so many more benefits from doing it. But like, in the same way, but really, machines do play a very important role, and I do mostly machine weights at the moment while I'm time poor. But in the same place, like, people get really movement purist about deep squatting, and I think like it doesn't count unless it's a deep squat. But really, like, you're trying to think, what are the adaptations that I'm trying to get, and if it's to get strong, to put on muscle, you can do that very effectively without a nasty grass squat. And if you're really keen on building that mobility, then doing it body weight or at a much lighter weight is going to be comfortable and easier. And so when people disqualify themselves from certain movements arbitrarily, but just because they think that's the only way to do it, I think it's just a real shame.
Look, I can certainly relate to that mindset because I used to do the same thing. I used to disqualify myself from squatting and deadlifting because of my lower back pain. And unfortunately, it was encouraged by practitioners that were far more knowledgeable than me, physiotherapists. But it wasn't until I really embraced those movements that were the problematic movements for me that kept triggering my back pain that I was able to sort of manage it and somewhat overcome it. You know, I still have, it's always, I think once you've had a really bad injury, you're always working out in the presence of that, and you need to be aware of it. And from time to time, it can, you know, flare up. You can do something that's a little bit abusive to that area of the body, or overload it, and yeah, you get a little bit of discomfort. Like my boxing, last week I went too hard rotating through the trunk doing my boxing, and my lower back wasn't happy for the whole week, you know. But that didn't stop me from exercising. I just sort of adjusted my load and didn't go as hard as I maybe wanted to go. And that's the same with your lower body training. You know, what Phil's saying there, that all these variables need to be considered. Range of motion is a really big one that people often forget. You know, there's not one way to squat. There's not one way to do a leg press. There's not one way to do a deadlift. You really, really do need to learn to work around your body's limitations. You know, learn to harness your strengths and work around your limitations. And if you do have a compromised area, work out in the presence of that issue, not avoid it altogether. And this is where working with coaches, I'm going to, throw in a little shameful plug here for both Phil and us, our Unity Gym or the Unified Movement System. You know, you don't know what you don't know. Rad said this during one of our, we have a leadership group, which is our UMS tribe, who have been with us for a year or more and are working on higher level stuff than building their foundation. And, you know, he said, you don't know what you don't know. So it's really important. We encourage our guys to post videos of them doing their workouts so that we can analyze them and give them feedback on their form and critique their technique and things like that. And it's so true when you're trying to train solo, go it alone without any coaching support. You really, really don't know what you don't know. And often you just forget, you may be very experienced and then forget that range of motion is a loading variable that you can manipulate to get the desired load dosage in each of your workouts. You know, it's not just how much weight you put on the bar or how many reps you do or how many sets you do. There's all these different variables that can be manipulated to find the ideal dosage for you that's going to trigger adaptation without injury. And if you're an absolute beginner who's really struggling to get started or find motivation, or coming from a really compromised state where you might have hurt yourself or overdone it in the past, then Phil is the best person to speak to get you on track. And if you've been training for 12 or more months, or just have a little bit of experience training and don't feel like you're just starting out, then I would certainly get in touch with us and do a trial of the UMS, and you'll love it.
It's definitely something that really experienced people kind of don't even realize as well. I was working with a client the other day in New Zealand, and he was 50 and he'd been training nonstop for like 30 years, started as a teenager, and it was really just a slight, just making him aware of these 5 variables and highlighting, like helping him identify which of the ones was the most aggravating for his shoulder. And it was just that like slight change. And he went back to the gym the next day and he's like, oh great, I can actually train just fine. And he'd been taking all this time off because he thought he wasn't able to do any upper body exercises ever again because his shoulder was sore when he tried to do a movement. But it was just, can we reduce the range of motion? And do you get that pain? Nope. Okay. So get stuck into it, and then over time reintroduce that range of motion and see how it feels. So to bring it back and make it really kind of practical for this person, I think like the important things to remember is, one, it's not like necessarily exercises, any one exercise is bad or not. It's about how you do it. So those are the 5 variables. And then the other thing that I think it was when we did a podcast with Nilesh talking about, which I really liked, is that it's not high load that hurts you, it's how you get there as well. So for people who haven't trained before, it's, you see these people, like you see Yani and Rad and other fitness professionals doing these amazing things, and you're like, oh, that looks great, and you try and do exactly what they're doing without having that training age. So you haven't had years and years of exposing your body to these type of stimulus. Like as I said before, with how your body adapts, like you need to be in that sort of zone of adaptation. And if you give all the right stuff, you can do perfect technique and you can do all the right stuff. But if you're doing too much of it and you go into that above that zone of adaptation, then you're going to end up sore and take a long time to adjust to it. So what you want to think is just like really, like you can do some like amazing high load. When we talk about load again, it's that intensity. So you can do very heavy, you can do incredible volume, like bodybuilders do crazy volume, you can do incredible range of motion. Like I just whenever I still follow Joachim Hilderson, who was one of the flexibility guys who was coaching Rad for a while. He came into the gym, and just seeing the way he like can hyperextend his knees absolutely freaks me out. Like it just
I get
feels
the same reaction.
Yeah, but his body is adapted over many years to be able to get into that extreme range of motion. And so if I tried to get to my knee in that position, I would be in a really I wouldn't be able to use that leg again ever, I don't think. But because his body has had that time to adapt, that's how, and probably there's some structural just genetic things there at play as well. But like it's not that high load flexibility is necessarily bad, it's just a matter of how you get there. So to bring that back and make it practical for this person who had the sore knee with the lower body workout, what I'd suggest is try and identify which of those 5 variables is the most aggravating, because it might be, and the way to do that might be, I'd probably start out with range of motion, because that is commonly for knees particularly the thing that really does hurt. So does it hurt when you go into a deep squat and put all of your weight onto your toes? Because when you go into weight into your toes, that's really going to load up the anterior knee and make that probably quite aggravating if you do have anterior knee pain, or you're going to go to that
anterior, meaning front of the knee.
Front. Yep, good. Good for having that. And then if you do that and see, do you have any pain at that time? If so, interesting. And then do this on like an upper body day, and then that way you can test the next day, do I wake up with any pain? And you don't have any of those confounding variables. So just like expose yourself to a bit of that range of motion, and then see, okay, do I have that next day pain? Do I have any pain in the moment? And then if not, all good. Now go back and do try and work through, okay, is it the intensity? So can I do the same sort of exercise and then it gets like there's a dose response to the heavier I make it, the more painful it is? Then okay, intensity is probably at play here. If you do volume, so if you get through, like if it's still a bit sore and you're a bit tender, going and doing the primary lifts and maybe only doing like 1 or 2 of the sets at the same intensity and the same range of motion, and then thinking, okay, is it just that I haven't accumulated all of that like load over a higher volume? Then that's one way of doing it. And then speed is often that other one which people sort of don't think about, where especially with squats, where they just dive on the squat, do 0 like eccentric, so the lowering component is very fast. If you can slow it down and control that end range, so you're not kind of bouncing off those passive structures, so the basically you're not putting your cartilage and your the joint at like an explosive end range, you're just gradually easing into it and coming back up with control, then that might be a factor as well. So I know it is kind of hard when you don't have that immediate, like it's painful when I do this. It's more of that like accumulation over time, but that's the way I'd sort of work through it and try and think, it might take a couple of days of this of trying out those different types of things, but hopefully by the end of it, you'll get a sense of, okay, I'm most sensitive to range of motion. Volume does seem to play a role of it as well. So what I'll do is just decrease the range of motion for the lower body exercises. So that might be doing a box squat instead. And, for maybe like the split squats as well, just changing that to a walking lunge where you're doing knees at 90 degrees as well. So just adapting the exercises slightly and maybe reducing the reducing the volume a little bit, but trying to keep that higher intensity, trying to keep that stimulus to keep you strong. So that's how I would be working through this if that person was my patient. But again, if this, just full disclaimer, like if you are injured and you're sore, please work with a professional to figure this out yourself, because pain can be multifactorial and come from different things as well.
You mean please work with a professional, don't try to figure this out for yourself?
Yeah, I mean, again, it's something where people just need to use their discretion. Like if it's just a minor pain that lingers for a while, like, we all want to sort of experiment before having to pay someone else to do it. But, if this is something that is significant and has been causing you some grief and you just can't wrap your head around, like I'd always recommend try and work with a professional.
Yeah, absolutely. So, and
Makes sense?
my final thought with this is to be really, really like into the process of figuring this out. Don't see this as I can't, like what so many people do, and we've touched on this. I'm not going to go too deep on it, but I've got pain in my knees, I'm just going to rest. You know, all this info that you've just been given, really get into it. Like, work out what is it that you can do, what is it that you can't do. I've got so many old injuries in my body that if I do the wrong thing, and I know the things that my body can't do, then I'm in a lot of pain for a long time. But I work out twice a day, every day, and I just know the things that cause me real problems, and I know the things that I'm fine with, and I avoid those things that cause me problems. So yeah, keep at it.
Yeah, and with the avoiding, like, you know, that doesn't mean that you can't ever do deep squatting or full knee bending again if range of motion is your issue. Like, what I'd suggest is just trying to gradually apply that range of motion gradually over time. So you're thinking, okay, I'm going to do like a 6-week block where I'm doing the box squats, and then the next block I'll do take the box away and go a bit deeper, but being really specific about the end range of motion, and then gradually reintroducing over time. And there might just be similar to me, where I've just got this structural knee issue from years of playing a sport where I had to pivot and rotate through the knee, that, you know, there's going to be a structural thing there that means that I can't, and that's okay. Like, there might be a surgeon who'd say like, oh, you definitely have to get that worked on, but for me, being in that position, apart from like occasional when I'm playing with my kid, it's a bit sore, but then doesn't cause any issues after that, then that's okay. And I can, I'm happy to leave that. But it's, just worth thinking, like, you don't have to push yourself to get these, you basically want to like reintroduce, test, and then if it's no good, avoid it. But yeah, with the knees particularly, like, do check out, be a bit careful about range of motion. And that's the thing I was going to talk about. Sorry. The last thing is, with injuries, like, I've really worked hard to frame it now. Every time I have injury, I've just got to, the first thing I've got to tell myself is like, every injury is an opportunity. And so for how I'd apply that to this situation, if your knee was sore with squatting and you're really getting to squatting, and that was the main thing that was like making you motivated for the gym, think, okay, squatting is now something that I have to be a bit more careful with, but I still want to stay engaged, still want to stay motivated. So if you can still load up the lower body fairly comfortably and you can do deadlifts, then you might be like, okay, sweet, I'm going to work on my posterior chain, so glutes, hamstrings, lower back, and really focus on deadlifting now for my lower body. Or, for example, when I tore my hammy and I couldn't do a lot of lower body work when I was training with Sebastian Oreb and doing the powerlifting, he gave me a 4-day-a-week bench press program. So that meant that I put on way more strength in my bench press than I would have otherwise. And that's where working with coaches is really handy, where they can kind of give you this guidance. But yeah, do try and see injuries as an opportunity to work on something else, because with exercise, it's all about the consistency. There's no one exercise that will, no hardcore workout you can do now that will make you strong in your 60s, 70s, 80s, 90s. Like, it's a long-term game. So we've just got to figure out ways that we can convince our monkey brains to stick with it. So that's my
beautiful
way.
I love it.
Whoops, I was muted. I hope you guys got some value out of that. And if you got ideas for podcasts for us or any questions, put them in the comments. We are here to help, and we'll see you in our next podcast episode. Have a good one, everybody.